Imetelstat is a telomerase inhibitor. It's a drug that had finished phase 3 in MDS, where we will have a readout on the data hopefully by the beginning of 2023. And if the phase 3 data are positive, hopefully that will translate to a new treatment option for our patients. This drug is also being tested in myelofibrosis in a phase 3 overall survival. Now, the original program tested Imetelstat in a phase 1, phase 2 study that's been published now in Journal of Clinical Oncology. Those patients were ESA failure patients, lower risk MDS, that received Imetelstat. It's a monthly IV injection. The original cohort included 38 patients of non-del5q patients that were lenalidomide and hypomethylating agent naive. In that group, there was almost a 42% transfusion independency, and some of those were durable, where around 30% of the patients, or 11, had a transfusion independency for more than a year. So Dr. Platzbecker at ASH presented our data on the group of patients that had a durable transfusion independency more than a year. Most of those patients were patients with ring sideroblast subtype, harbored the SF3B1 mutation. Those patients all had a prior ESA. A group of them actually had prior luspatercept, and their baseline transfusion dependency burden was high, with median 6 units of blood transfusion over 8 weeks. And it again indeed demonstrated that those patients had a durable duration of transfusion independency. It typically took around 9 to 10 weeks to get transfusion independent, but there is a group of patients that had later response. The range extended as long as 40 weeks to become transfusion independent. The median duration of transfusion independency among those patients was around 92 weeks. And indeed, there is a signal that among those 11 patients, around 9 of them had reduction in the SF3B1 variant allele frequency, suggesting there could be a disease-modifying effect for this treatment. And in terms of adverse events, the expected profile of toxicity, which is mainly myelosuppression, there are grade 3 and 4 thrombocytopenia, neutropenia that usually recover by the time of the second cycle. So those data are encouraging that there are subset of patients that will have durable transfusion independency with potential disease modification. And we are all eagerly awaiting the phase 3 data that again, hopefully will be positive that will translate into a newer treatment option for our patients.